Hi, I'm Dr. Jee, and I'm a cataract surgeon here at the Cleveland Eye Clinic. I had vision correction surgery right here at Brecksville Surgery Center, so I know what it's like to be in your shoes. I was nervous, just like you probably are. After my surgery, I decided to work with the team here at our surgery center to help put together a video so that you know what to expect on your cataract surgery day. I hope that you find this video informative and that it helps you feel at ease with your upcoming procedure. Please give us a call prior to your surgery day so that one of our financial counselors can assist you with your payment of your estimated out-of-pocket expenses. These include any copay, co-insurance, as well as any other outstanding payments due. You can use MasterCard, Visa, American Express, or Discover Card to pay this fee. We also can set you up on a third-party payment plan program. After surgery, your bill will be submitted to your insurance company. Once all surgery costs have been submitted to your insurance company, you should expect to receive 3 separate bills: a facility bill, a surgeon bill, and an anesthesia bill. 2 or 3 days before your procedure, a nurse will call you and give you an arrival time for your surgery day. The nurse will also review your health history and give you any special instructions about your procedure. Please make sure that you arrange for someone to drive you to and from the surgery center. We'll also want someone to be with you when you go home to rest after surgery. Bring a photo ID, insurance card, and means of payment to surgery. From the time that you arrive at the surgery center, your total experience will take up to about 3 hours. These are the doors that you should enter on surgery day. Most surgeries are done in the morning, and we start our patient arrival times at 6 a.m., so it might be a little dark outside. After midnight before your surgery, please do not eat or drink anything except for clear liquids up until 2 hours before your surgery arrival time. Clear liquids are water, orange juice without pulp, 7-Up, Sprite, clear tea, and black coffee. Most patients need some vision tests prior to the start of their cataract procedure. A Cleveland Eye Clinic technician will conduct vision testing. The tests usually take 30 minutes or less. After your vision tests are complete, the technician will return you to the surgery center waiting room. You'll spend time in the waiting area until a nurse calls you into the surgery prep area. In the prep area, the nurse will take your blood pressure and your pulse. The nurse will also ask you some questions about how you are feeling.
Good morning, how are you?
Good. The question is, how are you?
I'm doing okay.
The nurse will want a list of any and all medications that you are taking, including strength and quantity. A lot of people are surprised when they find out that they won't be put under or knocked out before cataract surgery. General anesthesia is not used during cataract surgery. However, your eyes will be completely numb for surgery and you will be sedated. How are you feeling today?
Good.
All right. The Cleveland Eye Clinic surgeons have a few different ways to help make you comfortable during your procedure. Twilight anesthesia is used for cataract surgery. This means that you are sedated but not unconscious.
Anesthesia-wise today, we do not go to sleep, but we basically make you nice and tipsy. So the procedures happen, you just don't care that it's happening to you. Your job is to actually look up at a light bulb during this procedure. I need you looking up at a white light. People don't see needles. You'll see little pinks and purple lights. You might feel touch. You might feel water dripping by your eye. Some people remember it, some people don't. We're your bartenders by your side. We're there holding your hand. If anything bothers you, all you have to do is squeeze our hand or say more, and poof, we mix you up another margarita.
Some patients will get intravenous anesthesia, meaning that your medications will be administered directly into your blood.
So what I like to offer my nervous patients is a pill that goes underneath your tongue, has a combination of 3 medications inside, a pain medicine, an anti-nausea medicine, and a relaxing medicine. Kind of mellows you a little bit before you go back to the procedure. Okay.
Other patients will be given a lozenge that's placed under your tongue to help relax you. Other patients may have a combination of the intravenous anesthesia and the lozenge. The surgeon and the anesthesiologist will counsel the patient on which type of anesthesia is best. About 10 to 15 minutes, okay? Now, let's talk about the actual surgery. Cataract surgery is pretty quick. The actual procedure only takes about 15 minutes. The eye that you have surgery on will be dilated prior to surgery, and it is likely to be dilated even throughout part of the day after surgery. Dilation makes your eye light sensitive and small print will be fuzzy. When your eye is dilated, you'll notice that your pupil is very large. Please wear loose, comfortable clothes to the surgery center. You will not be asked to change. Please do not wear contact lenses, jewelry, perfumes, cologne, or moisturizers on the day of surgery. Please take a bath or shower either the night before surgery or the day of your surgery. The operating room is kept at a cool temperature. You'll be given a warm blanket before you enter the operating room. While you're prepped for surgery, you'll be sitting in a chair that will recline all the way back so that you can stay in that same chair for surgery. You'll be wheeled into the operating room for the procedure.
Welcome to our operating room. You're all done, Susan?
After the surgery, most patients report that their cataract procedure was quick and painless. And most patients don't remember much about the experience. You'll be given a snack to go home with, and you'll want to plan for a nice, restful day. It's normal for your vision to be fuzzy and light sensitive in the operative eye. Your eye might also be red. Before you leave the post-operative area, the doctor may check on you after surgery.
It's nice seeing you.
When the doctor says that you can leave, your driver will be told to pull their vehicle under the canopy up to our front door. One of our nurses will escort you right to the door of your vehicle.
It's nice meeting you.
Thank you for watching this video. Our goal is to deliver great vision and a comfortable, safe, world-class patient experience. We look forward to seeing you soon.